We're in the season now, again, where people are starting to say, how long will the NHS remain free at point of use? The one thing you can be certain of when you start charging for treatment is that poor people are excluded. Personal healthcare costs are still the biggest single cause of bankruptcy in the United States. We all welcome the building of new hospitals, and then we looked and see, well, how are they funded? Well, they're funded through the private finance initiative, in other words, private companies, consortia, banks, finance houses are putting the money up, and we've already had, of course, the first PFI crisis drive a trust into bankruptcy. Two of those hospitals between them cost £214 million to build. They're going to cost £2 billion to pay for. They brought down that trust, they bankrupted the trust. So the PFIs were rescued at a cost of £700 million, and Lewisham Hospital stands to lose 60% of its services. Well, if NHS North West London has its way, they are going to make an average cut right across North West London of 28% of beds. You take the beds away, who's going to fill up the beds that are left? Emergencies. What happens when the NHS beds are filled with emergencies and you have a requirement then to treat people who are non-emergencies? Who's going to pick up the money? The private sector. We need an opportunity to vote against these proposals and for the NHS the way that we value the NHS as a universal service, funded from taxation, publicly provided and publicly funded. That's the way, the strength of it, an egalitarian service and one that meets need, not the ability to pay.